Hey, what's happening, Barnaby here? Another Hello Life moment with my friend, Dr. Jeffrey Chamberlain, who is a family doctor. Are you seeing more and more diabetes in your practice these days?
Yeah, diabetes is really on the rise. It's really the #1 health crisis that's going to happen down the road is diabetes.
Now, there's two types, correct?
There's more than two types of diabetes. There's really two major types we talk about, then a couple others that are kind of thrown in on the side. There's type 1 diabetes, which is kind of the classical diabetes. This traditionally happens a younger person, a child, where their immune system basically attacks the pancreas, which kills the cells that make insulin, and then the person doesn't have insulin anymore. Insulin is really important in our body because insulin helps sugar or glucose go from the blood into the cells. So a person with type 1 diabetes isn't making insulin. Their glucose can't go into the cells, which feeds the cells, so they can literally have high blood sugars, but their cells are starving for food, which causes a lot of problems.
But then the other type of diabetes is the one that is kind of a lifestyle-driven sort of a disorder?
Yep, and type 2 diabetes is diabetes where the cells are more resistant to the insulin. So the insulin's there, and they actually have high insulin levels, but the cells just aren't responding to the insulin well. So blood sugar builds up in the bloodstream, which causes a lot of problems. And then the other big issue is that the more we weigh, the less responsive our cells are to insulin. And so when we're overweight, particularly if we have a lot of fat in our system, then we're more likely to develop diabetes.
Okay, so as a general person, how does one know when you might have the onset of diabetes? Is it that you just start feeling different?
Yeah. So most of my patients I diagnose with diabetes, there's a couple things that they show up with. A lot of times they'll come in saying, man, I'm just going to pee all the time, I'm drinking all the time, I'm just kind of feeling blah, I have less energy than usual. Those are usually the first signs of diabetes. When we check their blood sugar, the blood sugar is through the roof, which kind of explains what's going on.
Okay, and so then there's probably a greater incidence in certain sexes or races, or is it pretty much an equal opportunity disorder?
For males and females, it's really equal opportunity. For races, everyone's at risk, really. And there's growing numbers of people with diabetes in all races, but there's some that are at more risk than others. Particularly Native Americans have a way higher rate of diabetes than everyone else, followed by Mexican Americans and Hispanics, then African Americans after that, and then European Americans, and then Asian Americans are kind of the pecking order of who diabetes attacks first, and so on.
Is it hereditary?
Yeah, a lot of diabetes runs in the family. For type 2 diabetes, there's a large genetic component to it. So if you talk to someone with type 2 diabetes, a lot of times they have several family members with diabetes. Sometimes people are at risk for diabetes, but then not until their weight hits a certain level do they start to develop the full-blown diabetes itself. So there's some people who maybe everyone in their family's been normal weight for generations, so there hasn't been diabetes, but now in this new generation with our new modern diet, we're all overweight. And now people are getting diabetes who didn't have diabetes before.
And I tell you what, that opens up a whole other can of worms that we'll deal with at a later time right here at HelloLife.net, and that is how to make it more tolerable, possibly even discuss the issue of is there a cure for any sort of diabetes, but that's all going to come at a later segment here on HelloLife.net. So that's a great reason to keep checking back because it's constantly evolving as we try to match your commitment to a healthy lifestyle. So thanks for all the good information.
It's good talking to you.
Check back.